Good afternoon. We're here to give you an update mostly on Bergen County and what's taken place so far since the onset of COVID-19 here in Bergen County, and over the last 3 days what's transpired and where we are in preparation and some things going forward. So again, it'll be primarily based on information that we're going to give you in regards to Bergen County. But I want to just take a step back and go over yesterday. So yesterday, once we found out that we had a confirmed presumptive case here in Bergen County, we spoke with the officials from Fort Lee. And yesterday, as you all know, we were in Fort Lee, and the good news out of the Fort Lee was that there was very little exposure to the residents of Fort Lee, and Fort Lee's back and open for business, as Mayor Sokolich said. But out of that, and out of the testing of the person from Englewood, we have found out that both of those people had visited an urgent care type facility or a commercial type health facility prior to going to the hospital. And so that location was in Bergen County. And as I speak here today, the investigation of the exposure or the people that may have come in contact with those two people is continuing and is underway. We do have some names. Those names were given to the state health department, and they are then going to decide what to do in regards to those folks. So while there was real good news there from a Fort Lee standpoint, and certainly from the woman from Englewood that is asymptomatic and is self-quarantined at home, we do have some other work to do here in Bergen County in regards to the people that were at the facility here in Bergen County. One of the other things that we are asking everybody to do is, before they go to one of these facilities, to please call ahead, because what happens is if they walk in the room, the people that are there that may not be there because of that type of an illness, then could be subjected to becoming contagious from the people that are walking in. So we ask again that if you're going to go to the hospital or you're going to go to a facility, a healthcare facility, that you call ahead. One of the other things that has changed today is there were guidelines put out by the CDC in regards to 911 centers, the centers that are taking emergency calls. Bergen County has a 911 center. They are now going to screen those calls for the emergency responders, so that if the person calls and says, I'm feeling ill, I'm coughing, I have a fever, they are to ask a series of protocol calls so that when the EMS responders are dispatched and the police officer are dispatched, they can know that they potentially are going to call that they need to now have a different level of PPE, which is personal protection. And the protection means that they have to have the same level as a healthcare worker. So that means gowns, that means gloves, that means face shield. So that's just changed just today, and those guidelines are just put out. We are working with our 911 center to implement that protocol and make sure that we protect our EMS workers and our first responders. There's also been a protocol put out for law enforcement, and we are communicating that to our law enforcement partners, the prosecutor's office, the sheriff, our security force, and anybody in law enforcement. There is now a protocol from the CDC about how law enforcement officers should respond to these types of medical calls. One of the other things that we're talking about is price gouging, and that has on social media and throughout the county, we are hearing and getting information about price gouging. We are going to take a very proactive role through our Consumer Affairs Department in addressing price gouging. I will tell you that I will have no tolerance for that. Back when Superstorm Sandy hit here, we faced the same thing. While I wasn't the county executive, I faced it as the mayor of Paramus, and the stores in and around Bergen County should not be price gouging and making people not have the ability to take care of themselves. And that's just not right. And so I'm going to ask our Director of Consumer Affairs, Christina Deloya, to come up, and she will tell you the steps that we have implemented starting today or yesterday, and where things are in regards to price gouging. Christina?
So we are asking all residents to report increases of 10% or more in the price of sanitizing products. This includes surgical masks, gloves, hand sanitizing gel, Lysol wipes, Lysol sprays. If you can call Consumer Affairs at 201-336-6400. In addition, we will be investigating every single complaint that comes in. So if you suspect price gouging, just call us so that we can go out and handle it. We will also be issuing warnings to stores. So if we find you in violation, you will be warned. And there could be up to a $10,000 fine per item sold, per incident, for each violation found. We're also going to be sending our investigators to conduct spot checks at stores all throughout the county. We handle both Bergen and Passaic. So we're going to be sending our investigators out starting Monday to all stores in different areas. Thank you.
Thank you, Christina. I do want to give you another update in regards to another potential person in Bergen County. There is somebody that is hospitalized, that is elderly, that is in one of the 6 hospitals here in the county. The person has been tested, but we do not have the results of that test back. So while we have 2 presumptive confirmed cases, we do have somebody else that is in a Bergen County hospital that has been tested, and we are awaiting the results of that test. Next, I would like to have the Bergen County Health Officer, Hansel Asmar, give you some updates in regards to, from an overall health aspect, things that are happening around the county. The other thing that I do want to say is that while we're waiting for the results of this test to come back on the person that is hospitalized, we do have people throughout the county that are self-quarantined, right? They've decided that based on whatever the factor or potential exposure that they had or wherever they were, we know that they have decided to self-quarantine, and then depending on what happens while they are during that self-quarantine, they would then take the proper action. But we do know that we have people throughout the county that have already self-quarantined. So at this time, I'll ask Bergen County Health Officer Hansel Asmar to come forward.
Good afternoon. The Bergen County Department of Health Services is closely monitoring reports and guidance regarding novel coronavirus COVID-19 from the Centers of Disease Control and the New Jersey Department of Health Services. As you're all aware, there are 2 confirmed cases of COVID-19 in Bergen County. We are closely working with our federal, state, and local partners to monitor new developments and are actively monitoring any individual living in Bergen County who is at risk of contracting the illness. The risk for our residents still remains low. Rest assured, though, that our team is taking the necessary steps to prepare in the event of a broader outbreak. There are additional action steps that we're taking from our department. We have developed and disseminated a COVID-19 municipal toolkit to local municipalities. Also, we've developed a COVID widget that municipalities can use for their so their users can directly get information from our bergenhealth.org COVID information section. Our health educators are providing COVID-19 presentations to local municipalities. Starting next week, we'll be holding weekly conference calls with our with towns that we represent, and invitations extended to the other 35 municipalities if they wish to participate in the conference call. We urge Bergen County residents that the best way to protect yourself from contracting or spreading viruses is to demonstrate good, common hygiene practices. These are still valid for cold, flu, and COVID-19. The first is covering your nose and mouth with a tissue, and the next thing is washing your hands properly and often with soap and water for at least 20 seconds. If you don't have soap and water, use a alcohol-based hand sanitizer with a minimum of 60% alcohol. Avoid contact with sick people. Avoid touching your eyes and your nose and your mouth as much as possible. And if you're sick, stay home from work or school. If you want any additional information, you can please go to our bergenhealth.org website. We've also developed a BC Health Safety Hotline for residents if they have any local questions, which is 201-225-7000. 201-225-7000. Thank you.
Thank you, Hansel. As you know, the Office of Emergency Management plays an important role in all of this. And yesterday, being in Fort Lee, we learned a lot. And as we're the only county in the state that has a presumptive confirmed COVID-19 resident, everybody in the state is calling Bergen County to find out what's going on, how you're dealing with things, and what should we prepare for and how should we prepare. And I have to tell you that, as I said to many of you on Monday during the press conference, we are prepared, but we also are learning as this happens. And so I'd like to ask the coordinator of the Bergen County Office of Emergency Management, Sergeant Matt Tiedemann, to come up and give you an update on where things stand with that.
Good afternoon, everyone. Bergen County Office of Emergency Management continues to support and coordinate along with the Bergen County Department of Health Services to prepare for and respond to cases of COVID-19. Hundreds of first responders have signed up for our first responder training to include police officers, firefighters, EMTs, emergency management officials, and also through training we're offering through the Medical Reserve Corps, our CERT personnel. One thing I just wanted to address is that we've received numerous inquiries regarding the drinking water. A lot of people stocking up on supplies such as masks and hand sanitizer, toilet paper, paper towels. You can't find any of that stuff on any of the shelves. People are starting to question, stocking up on bottled water, and there's no more water on the shelves. I spoke to the lab at Suez Water, which is the largest water provider in Bergen County, this morning, and they have assured me that there is no threat to the drinking water at this time, and that they continue to monitor for anything, and that they'll advise us if there is anything there. So it's good news to report there. As the county executive said, we had the unfortunate experience, I guess, of having the first COVID-19 case in the state of New Jersey. So there's a lot of learning to do as far as properly responding with all state agencies and all other partner agencies involved. So as such, we've decided in Bergen County to create a task force for responding to these incidents. So the task force is going to consist of one person from the Office of Emergency Management, one person from the Department of Health Services, one representative from the administration, and one representative as a public information officer. In dealing with the situation yesterday in Fort Lee and the other possible presumptive cases, we've identified several other things that need to be addressed. So we're going to address those through this task force, and that's going to be the primary response for all of the towns that we provide health services for, and it's going to be available to all of the other towns, regardless of whether we provide their services or not here in Bergen County. So as the Office of Emergency Management, we're going to continue to monitor the situation and adapt as necessary. We'll respond accordingly in conjunction with our allied partners, and we'll issue any updates that are necessary. Thank you.
Thank you, Matt. I actually have a statement from Suez Water that I'd like to read so that everyone can feel comfortable and know that the drinking water here in Bergen County is safe. COVID-19 is known to spread from person to person through close contact, similar to how the flu is transmitted. There is currently no evidence to support that the coronavirus COVID-19 is transmitted through drinking water. COVID-19 can be disinfected through the use of ozone, chlorine, or other treatment processes used in the processing of your tap water, which is the process used by Suez in New Jersey. Suez uses multiple steps in our treatment process that physically remove, disinfect, and chemically inactivate viruses, bacteria, and other living organisms from our drinking water. Coronavirus, or COVID-19, is susceptible to drinking water treatment processes. So, the process that's used by Suez addresses the issue of COVID-19 or the coronavirus. So again, no one should be out there hoarding water based on this issue. I also want to say that I have been in contact with the Commissioner of Health directly, both last night and today. Also the Governor's Office, to provide them updates and for them to provide updates to us. That line of communication continues to exist. Depending on how this evolves, it will continue to either grow or it'll continue to remain the same based on the information that we need to provide to them and they want to provide to us. But certainly that linkage is there, and we're learning, as I said, every day in regards to this, to how we can improve it and how that, should this spread to other communities and other counties, we can help them with this. As you know, there was a directive put out by the Commissioner of Education yesterday. It does lay out what would happen should there need to be school closings. And at this time, I'd ask the Executive Superintendent of the Bergen County School System, Lou Delicio, to come forward and explain the changes or the process today. Superintendent?
Thank you, Jim. Good afternoon, everyone. As I stand before you today, there are no confirmed cases of COVID-19 among school-age children in Bergen County, so I just want to make that clear. Over the course of the last 2 days, I've been contacted by several district superintendents reporting parents who have chosen to self-quarantine their children over concerns that either they or their children may have been exposed to someone confirmed to have contracted the virus. There's actually a family who was traveling out of the country who has a concern, and they've chosen to self-quarantine their children. And there's also another family who the mom is a healthcare worker in Bergen County in a hospital. She has chosen to self-quarantine her children. There's one private school in Bergen County that has chosen to close as a result of students possibly being exposed to people who have contracted the virus in New York City. They will be sanitizing the facility over the next few days in an effort to ensure the safety of the students attending that school. Again, as I report to you today, none of the children residing in Bergen County have exhibited symptoms of the virus. Bergen school districts have been provided with information related to prevention from numerous sources, including the New Jersey Department of Health and the Center for Disease Control. And I might add that the Bergen County Executive has done a wonderful job in reaching out through me to school districts in Bergen County, so much appreciated. The New Jersey Department of Education, in conjunction with the New Jersey Department of Health and local health officers, have conducted numerous conference calls with educational leaders throughout the state and provided guidance for public health-related school closures. The decision to close a public school in Bergen County or in the state of New Jersey will be a collaborative decision that will be made with the Department of Education, the New Jersey Department of Health, and local health officials. School district leaders in Bergen County, as we speak, are in the process of preparing plans in the event that a closure is advised by one of the agencies that I just described. Those plans will be submitted to my office as soon as possible for approval and to ensure that they are adhering to the guidelines the New Jersey Department of Education has presented. This is the first time, to my knowledge, in my 45 years in education in New Jersey and in Bergen County, that in the event of an emergency closing, as long as the school district can continue the continuity of instruction for students, those days will count toward the 100, those days or day will count toward the 180-day mandate. Finally, the New Jersey Department of Education has included in their correspondence to school districts a recommendation to adopt enhanced cleanliness and disinfection procedures, especially to frequently touched areas and objects in any school. So again, I'm happy to report today that as of right now, the risk is minimized to our school children in Bergen County. I thank all the agencies of the Bergen County administration for their help, for their assistance, for their communication and ongoing support. Thank you.
Thank you, sir. As I said on Monday, we have the largest community college in the state of New Jersey, and it has 3 campuses. It presents a challenge in regards to it's also the most diverse educational institution, I believe, in the state of New Jersey. And Larry Havenka is here to talk about the challenges and also, because of spring break, what is going to take place with the students when they return from spring break. Larry?
Thank you, Mr. County Executive. So this is a responsibility that we take very seriously as the state's largest community college. And we are a diverse community college, as the county executive said. In addition to the good best practices that have been mentioned earlier that we are stressing with our students, faculty, and staff, we have also, much like the K through 12, begun to create task force that deal with our academic continuity and our business continuity. But most important is the following, and that is the fact that we are on spring break next week, which means that we will have students, faculty, and staff perhaps traveling all over the world, internationally and perhaps even domestically. So we have taken action today to somewhat limit that travel, or at least ask that if they are going to be traveling abroad during spring break, if they are traveling to a level 3 country as defined by the Centers for Disease Control, that those students, faculty, or staff inform the college before they return by reaching out to our college nurse at the our Center for Health, Wellness, and Personal Counseling. We would then ask if they have been to a level 3 country to conduct a self-quarantine for 14 days. And then once that 14-day period is completed, they would be able to come back on campus. Again, we realize that this is a specialized scenario because we are going on spring break and people will scatter, but we feel it is important that we institute this temporary policy to ensure that we can try our best to keep our college community safe and protected. I too would like to thank the county executive for giving us the opportunity to project this information today and his ardent support of Bergen Community College. Thank you.
Thank you, Larry. And certainly not last, but you all know that Bergen County owns the largest hospital in the state of New Jersey, the 4th largest publicly owned hospital in the country, and on Monday we announced that the hospital was rolling out a telehealth program, and I asked Deb Visconti to be here today to give you an update on how that rollout's going and the activity that is seen. So Deb.
Thank you, County Executive. Good afternoon, everyone. As the largest hospital in the state of New Jersey, a safety net hospital, and the largest nursing home in the state of New Jersey, we care for the most vulnerable in our communities, those that may not have access to the same health services that others have within the county and the state. We are prepared, we are ever vigilant in assuring that the safety of our patients, our residents, our staff, and our community is front of mind. And with the recent cases here in Bergen County, we continue to elevate our readiness, our preparedness, and our vigilance. To that end, as County Executive mentioned earlier this week, we expanded our telehealth services for anyone who is home and feels ill to call our number 201-204-0712, and they'll have access to clinical staff and an infectious disease physician as necessary without the individual having to leave their home. We've got a number of calls on that hotline. A lot of people are just worried and are asking questions, which is great. That means that people are accessing our medical professionals. And effective on Monday, we're actually going to have the telehealth capabilities available on our ambulances, on the Newbridge Medical Center ambulances. So if you call directly to the ambulance company, 201-831-1700, those ambulances will be equipped with telehealth capability right on the rig. So it's just our position, our responsibility to the community to assure that we provide access to health professionals at every opportunity that we can. The best way to avoid an outbreak is to contain and place. So if you're sick, stay home and call a health professional, such as Newbridge Medical Center. We stand prepared to assure the safety and well-being of our county. And thank you to the county executive and all of our partners in the county of Bergen for your support during this time. Thank you.
Thank you, Deb. Before I end, I just want to take a minute to thank the rest of our partners and also to thank the members of the Board of Chosen Freeholders that have joined us this morning. We have the chairwoman of the Board of Chosen Freeholders, Mary Amoroso. We have freeholder vice chair, Dr. Joan Voss, freeholder tempore, Steve Tonelli. We have the assignment judge, Bonnie Misdall, representatives from the Sheriff's Office, Prosecutor Musella, and probably many others that I didn't get. Let me just cover a couple other things. At this time, there's no recommendation to avoid large gatherings. So here in Bergen County, we will not be saying or stopping any large gatherings or making any recommendation to stop large gatherings unless we hear back or more from the state health department. One of the things that I also talked about both Monday and yesterday was that we need to continue to avoid to stigmatize this disease. COVID-19 is blind to ethnicity and national origin and not tied to any one group or community. I've spoken with the prosecutor about this, And he has assured me that if we receive any information about any type of bias or any stigma to anybody talking to anybody or saying things about people's ethnicity or national origin or trying to tie this to anybody of any one class or group, he has said that he will continue to investigate that and make sure that we find out the people that are behind that. We're also currently assessing our county resources, especially our Meals on Wheels program, and we believe we have a contingency now so that those that need food that we deliver to will be able to do that should we have to look at some type of large-scale stoppage of our Meals on Wheels. If any businesses here in Bergen County or anywhere should have questions, the health officer gave you a phone number. We urge those folks to call us and ask any questions so that we could answer them. In our transportation section, Bergen County has a large transportation system, and we supply transportation for Bergen County residents to hospitals, to dialysis, to the Veterans Hospital in East Orange, all over Bergen County. We have now taken the steps to have the buses cleaned on a more regular basis. We're outfitting our drivers with gloves and wipes so that they can protect themselves as our employees, but also make sure that they wipe down the handrails and things like that in the bus. When the buses come in at night now, we're taking more action in regards to cleaning those buses, cleaning those vans, so that when the people get into them the next day, they can feel safe and comfortable that the buses are clean. And I guess the last thing I want to say in regards to all this is that while Bergen County continues to be the point where this disease is focused on, we will continue to provide the information to the public, and that's what I'm trying to do here today. I'm trying to get the public to have the information to make them feel as comfortable as possible. What I saw yesterday, after we were able to tell the people of Fort Lee that what was taking place in Fort Lee, where the person had no contact with anybody, was on a ground floor apartment that didn't affect a large portion of that community, you could feel the sense of relief in that community. And what we're trying to do here is we're trying to give people information, facts, so that prevents fear. It prevents people from doing things that they don't have to do, like hoarding water and many other things. And so as long as we here in Bergen County are the ones that are in the forefront of this, I believe it's our duty and our obligation to provide information to all of you to help get this message out, that it's still a very, very low risk to the 1 million people that live here, to the hundreds of thousands that work here and visit here every day, and that as things develop, we're going to continue to let you know, and we're going to give you all the information we can to make sure that you can provide that to your family, but that everybody feels as safe and secure as they can be. Matter of fact, so much so that the shirt that I'm wearing today is my public safety shirt, because that's what the importance is. It's about the safety of the people here in Bergen County, and our job is to make sure that we can provide that safety and we can make sure that the people get the information that they need. I'll open it up to any questions if anybody has any questions. I'm not permitted to say that.
Is it the same urgent care center that both went to, though?
It is.
Well, Jim, you know what happened. The absence of facts, you're rumors. If you don't tell us every urgent care center in this county is subject to people saying.
So it's not urgent care, it's a healthcare facility that is a commercial healthcare facility, so it's not urgent care. So I want to make sure that it's not a named. I'm not naming the name of the facility. What I'm saying is that that both people went to a facility before they went to the hospital to get a treatment, and then went to the hospital after that. We've now identified, or the health officers in the town has identified those names, sent it on to the state health department.
Why won't you tell us?
What?
Why?
It doesn't make any difference.
Well, for the people who live in those towns,
They
it
do.
makes a difference.
They know.
Yeah, but the people
No.
who live in those towns, it makes a difference to
It,
them.
well, it would make a difference to them because they didn't go.
If I live next door to it, I care.
It certainly was not in a residential area.
What happens at that
That-
facility,
so-
and how are those other patients there tracked?
So the people that went there, those are the two that tested positive. The other people that were there, while they were there, they've been identified. Their names have been given to the health department. The health department is now taking that information and doing what they do with that information.
Reaching out to them.
Brian, I don't make that decision, but my guess is that's what they would do, yes.
Jim, can you tell us more about the third person?
I'm sorry?
This third person that's being tested,
So the person is a Bergen County resident that's in one of the 5 hospitals, has exhibited pneumonia-like symptoms, and that person has been tested, as I said, and we're waiting for the results. We don't know who they are. As you heard the executive superintendent said, there are parents that are choosing to keep their children home from school. There are others that many people got letters from the state of New York that were up in New Rochelle to stay, that were there to self-quarantine. So we don't know every single person or people that were that, but we do know that they are throughout the county.
How important is it for the continued self-quarantine?
Through the 14 days, it's really important.
But we are hearing from teachers in Bergen County who are saying, my class typically has 22 kids, but yesterday only 11 showed up. And I'm hearing that from numerous teachers. It sounds like parents might just be acting out of fear, even if they had it traveled on before. This kind of superintendent can kind of speak to the high rates of absenteeism.
I'll certainly let him speak to that in particular, but you said that you said it. Are they acting out in fear? And what we're trying to do today is help give them information to eliminate that fear or to minimize that fear. And again, the risk is low. As you heard, no one in the school system has even exhibited or said and have communicated anything in regards to the way they feel or having some kind of an illness. So I'll let the superintendent address the absentee rate. But again, our job is to provide information so that people can make good, informed decisions, and that includes parents with school children.
So yes, I have been apprised that there are certain school districts that are experiencing slightly higher levels of absenteeism than is normal. Although this time of year, absenteeism rates are slightly elevated. As is typical protocol in every school district, when a student is absent, a school makes every attempt to contact a parent or guardian and ask the reason that the child is absent for the day. The only things that have been reported to my office so far are people who have notified the superintendent or the school district that they are choosing to self-quarantine their children because of a possible exposure. As I mentioned previously, one family was out of the country on a vacation and had a concern, and one family has one of the parents who works in one of the 6 hospitals in Bergen County. Other than that, I have not had a report from any superintendent in Bergen County that there are any other extraordinary circumstances related to absenteeism. So I hope that answers your question. Thank you.
Anybody? Yeah. I don't have a lot of detail on her travel prior to the of her being determined to have a presumptive case. So I know from speaking with the mayor that he had indicated to me that he had gotten information in regards to she may have been working with or in the same building as the first presumptive case out of New York, but that's really all I know out of the second person, the woman in Englewood. Yes.
For the CDC to get back to get that final confirmation on those two cases, and also is that commercial care facility, is that still open into patients at this time?
So the results from the CDC, I can't tell you. That's from the state to the CDC. So I can't tell you when and if the word presumptive comes off and it's confirmed. I can't tell you that. And in regards to the facility that treated those two, yes, that facility is open and operating.
Just to clarify,
Sure.
second patient home now and asymptomatic, you said?
So when I spoke to, and you spoke to the health officer, yesterday, late yesterday, I spoke, I guess about 5 o'clock last night. The patient had been released from Englewood Hospital. It was asymptomatic and is being monitored at home.
But is under self-quarantine or not?
Isolation at home. Yep.
Is that a house or an apartment?
That I don't know.
And she lives in Englewood.
She's a resident of Englewood.
Does she have children in school, other people she lives with?
That I don't know. That I don't know.
First guy still in the hospital?
As of last night, the last time that I was given any information, the person was still in the hospital. It was the same as in the morning. I'm not aware of any status change to that person. We've not been given any status change. I'm sure if the status changed, we would have heard by now, but I haven't gotten any. Anybody else? Any questions? So again, I want to thank all of you for being here. I want to thank you for getting this information out. I will give you information, and those of you that know me for many years know, I will give you all the information I can give you. There's no intent for me, and there's no reason for me not to give you the information. That's why I'm holding this press conference, to give you the information. I will give you all the information that I can, that I believe is important for you to know and is important for the people of Bergen County and the state of New Jersey to know. So I have no problem answering questions. I have no problem taking questions. But when I tell you I can't tell you, I'm telling you I can't tell you because I can't tell you.
Can you tell us what town the third person is from in Bergen County?
I can't give you that information. It's one of the 6 here in Bergen County.
County Executive, I'm hearing from different people that some people, 211 wants people to call them, hospital wants to call them, some towns want them to call their town. Should people be calling that 211 hotline, or what, or can they call all of them, or who should they really be calling? Is there a sensitized?
So I don't know that I can tell them to really call any one of them, because I guess it would be what information they're looking for. But the poison control hotline that the state of New Jersey put up, that has a myriad of information. We just came up with a number today that we just provided you all. It is, again, 201-225-7000. And again, that's a health and safety hotline. So if people in Bergen County want to call that because they feel comfortable calling, because they live here in Bergen County and feel that they'll get some information from Bergen County or it's specific to Bergen County, that's why we put this number up, and we would encourage them to call. Okay? Ladies and gentlemen, thank you again.